Today we're going to do a skills review of a manual blood pressure. This is going to be an important skill for us here in community health because we're going to be out in the community, and one skill that we're going to do on every single patient that we come in contact with is a manual blood pressure. You're not going to have access to things like a Dynamap or any sort of other equipment like that, but you are going to always take your manual blood pressure cuff every single place you go. So we're going to want to make sure that this is a skill that you've dusted off from 241 and that you remember how to do it and feel confident doing it. So the first thing that we're going to want to do is position our client in a comfortable way. We want them sitting with their back comfortably against the back of the chair. We want their arms supported at approximately heart level. We want their palm facing upward. We want their feet flat on the floor and their legs uncrossed. Just like Ms. Womack is sitting, she feels very comfortable and she's excited to have her blood pressure checked today by a St. Preux nursing student. We want to then take our cuff. We're going to position our cuff after we've sized it appropriately. Looking for the artery marker. We want to line our artery marker up with Ms. Womack's brachial artery. And first we're going to estimate our systolic pressure. Position your cuff snugly. You'll remember from 241, to estimate your systolic pressure, we're going to do so first by palpating the brachial artery and inflating our cuff until we can't feel the systolic pressure. Get my cuff right. I have my estimated systolic pressure for Ms. Womack of 126. Now I can go ahead and take my stethoscope out. And this is a double-sided stethoscope. That's what you'll be using on clinical readiness day. Of course, in practice, you'll have your traditional stethoscope. I'm going to give her arm about a minute to relax. Lay that down so I can hear. I'm going to take my stethoscope. I'm going to position it. Excuse me. I'm going to position it over the brachial artery, making sure that I'm not pressing down too hard so as to occlude her brachial artery. I'm going to leave these out so that I can talk to y'all. When I inflate my cuff, I want to inflate 30 millimeters of mercury higher than my previously estimated systolic pressure. I'm going to go ahead and inflate my cuff. Make sure that I can see. Once my cuff's inflated, I'm going to slowly open the valve of my manometer, and I'm going to allow the air to release slowly, about 2 to 3 millimeters of mercury per second, and I'm going to start listening. The first sound noted is going to be my systolic pressure, and the last sound noted is going to be my diastolic pressure. We want to get our sound or our numbers within 2 millimeters of mercury. Now is when you can tell your client or Ms. Womack what their blood pressure was for the day, and we can report to Ms. Womack that her blood pressure was a perfect 120/80. Do you have any questions about your blood pressure today?
No, thank you.
It was perfect. Thank you.
Thank you.